This is the first phase of the next evolution of Community Hospital South. It's 6 state-of-the-art operating rooms. I'm going to take you through and show you our locker room space right now. This was a very important piece for physician satisfaction. One thing that we were running into is in our old locker room, we never had enough space for the physicians, for the staff, and for visitors to come in. So in the men's locker room, we now have 46 lockers. In the women's, we have 70 lockers. The locker rooms go straight into our lounge. The nice thing about the lounge, before it was hardly big enough to fit about 12 people in the lounge, and if it was 12 people, it was a very tight fit. So this allows us to have everybody in the lounge. One of the concepts that VEI, we've always have done, is the staff and the physicians share the same lounge. How we look at it is as a partnership between us and the physicians. We get to know them, we work with them, we get to know their likes, dislikes. We spend time with them, we eat lunch with them. As you look around the lounge, you can see there's plenty of area for sitting around, lounging, eating your lunch. We have bench-style seating, which is kind of a different concept. We have an expanded kitchenette and 2 refrigerators. One of the important things to know about the ORs that we built, in the planning stages, we had a lot of physician and a lot of staff input into the design, the layout, and how we wanted to go about, for the next 30 years. Over here we have a bed alcove, which is very nice. Before we didn't have the capability of, putting a bed in a certain spot. It was always laid out in the hall, or it always seemed like it was in the way. When we go into the rooms here, it's the doors. You just have to wave your hand, and the doors will open. When we step inside the ORs, it's important to note that each one of these ORs is very identical. They're actually all identical to one another. Each room, the doors are on the same side, the cabinets are on the same side. We have a nursing station. The nursing station here is integrated, where we have stores and Berktold lighting. The nice thing about that, with the integration of the nursing station, all light, all high definition video and radiological images can be controlled at this workstation and can all be brought to this field. The booms were very important for us because it helps keep everything up off the floor. In the past, we've had rolling carts that we'd roll the carts in here. With the booms, everything is up off the floor. We now have monitors that are suspended, and these monitors allow the physician, whether this is a laparoscopic case or it's just a spine case or another type of case that doesn't require the monitors for the actual procedure, it's beneficial in the fact that you can pull x-rays up here. We have the capability of doing digital x-rays now, C-arm images. With all the different data inputs along the wall and on the boom, we can plug directly into that, and that will feed directly up here and will be in front of the physician. Also, you can pull up documentation, which is very neat on this. You can pull up the documentation if they want to see maybe an op note, or if they want to see something that they've written or a consult. It can also be sent straight up to the monitor, which is a very nice feature. These are the next phases of Community Hospital South. Community Hospital South has always been known as kind of a small community. I think the physicians and the patients kind of like the small hospital feel to it. With these operating rooms, we can show with advanced technology, we're able to do the cases, difficult cases and the larger cases, and still hold that small time feel. All the data inputs along the wall also give us the capability of doing bigger procedures like the Da Vinci. We can plug that directly into there. We can route that straight up to the monitor, and that's something that we look forward to in building on in the future. And as we head into room 2, what you're going to notice is there's a green light. It's a green tint. The purpose of this green tint is so when the surgeon does a laparoscopic procedure, or they want to see something kind of in detail that's on the monitor, the green tint allows that to stand out, and the physicians can better see the anatomy, and it's much easier on the eye. One thing I didn't point out in the other room is the view boxes are the same in every room. There's a capability for 8 films if needed. It's usually big for neurosurgical cases or spine cases. In this room here, you can see we have an Allegro bed. This is a new bed that we purchased specifically for CV procedures. We can also use it for other procedures, but this allows us to do endoscopic aortic abdominal aneurysm cases. Typically, these cases are done at the heart hospital. We have done some of these in the past at our other facility, but with the larger rooms, it's an example of a case that now we have plenty of room to have our wires, have our back tables, and to do these cases without the fear of contamination or patient safety related issues. Some of the nice features about these rooms also that I'd like to mention is the energy efficiency. On the wall here, you'll notice there is temperature and humidity settings here. Why this is important is now we're always looking to conserve energy and to cut costs. At the end of the day, we can switch that to unoccupied and it will go down to a default temperature setting and humidity. Another thing I'd like to point out is up here, that is a positive pressure alarm. And what that tells us is for the safety of the patient and for infection control reasons, that we have enough positive pressure to keep germs and everything else outside the room. And if the doors are open and we're not maintaining that positive pressure, what will happen is this will alarm. It will alarm all the way down the main corridor here until the room is closed and that pressure is built back up. The cabinets and everything are on the left side of the room when you come in. Each room is exactly the same. It was important for us to have the doors on the same side of the room. We kind of went with a different concept called a Sterile Core. And what the Sterile Core does, it takes all 6 rooms, and in the center of it, we can walk in there, grab equipment, we can go into the autoclaves, and it is a shared unit. I'm going to walk around here to room 3 where we have a spine room set up. And a spine case is an example of a case where you're going to have possibly a microscope in here. You're going to have the possibility of having a bovia, which is a cautery device, and you're going to have a neuromonitoring stimulator. You're going to have a person monitoring that in the background. This room gives us the capability to do those types of procedures. So really, I think with these advancements, we're coming a long way. I think we can provide more efficient and high quality surgical care. I think kind of how it helps this patient, how it helps the patients here in our community and the Southern Indiana communities is that they're able to come to Community Hospital South, and with coming to Community Hospital South, they know that they can have their procedure here. They don't have to look elsewhere for the big procedures. We have the capability of doing those here at this facility, which is very nice. We're excited at Community Hospital South to have these 6 state-of-the-art operating rooms. It's the first phase of our renovation for the next evolution of Community Hospital South. In the future, what we look forward to is to have 17 pre-op rooms, 9 PACU rooms. We will have a waiting room that can encompass a whole entire family. It will have a kitchenette in there. It will have a computer in there. It will be very family friendly. We will have consult rooms, 3 large consult rooms where the doctors can sit down with the patients, not worrying about HIPAA violations or things being overheard. We're going to have a clinic area for a clinic nurse, which clinic, what that does is for the surgical procedures, it helps the patient come into our system, that we have the proper labs, we have the proper clearance, that when they get here, that their procedure proceeds very smoothly to the back, and also that they're followed up after their recovery. So those are some exciting things that we have at Community Hospital South from the surgical component.